Hello, I'd like to take you on a whistle-stop tour of the new NHFD report, a report on care in 2024 that's just been published. We've focused in the report on three areas which patients have identified as being their main concern. First of which is a wish to be made comfortable when they first present to casualty. We've seen an improvement in the number of people receiving nerve blocks. About 3/4 of patients now receive nerve blocks as part of their admission. But the time that people are spending in casualty is very variable. There's been an improvement in many hospitals managing to get people to the right place quite quickly. But a number of hospitals have an average time for patients to be waiting in inappropriate places in ED or non-orthopedic wards of over 24 hours, something that clearly needs to be challenged in those centres. The second focus that patients have is on having effective surgery that allows them to get up and get back on with rehabilitation as soon as possible. We're screening patients for delirium both before and after surgery now, so trying to avoid delirium being an impediment to rehabilitation. But what we have seen over the time since the COVID pandemic, and the green line, is that there's been a deterioration in the proportion of patients who are getting to theatre by the day after they present with a hip fracture, and that remains a challenge. It has the potential to explain the instance of pressure sore, and we're still seeing pressure sores in patients presenting with hip fracture. We're also, in this report, we're calling the report Room for Improvement, identifying specific areas where data is suggesting that individual hospitals are having a problem. And you can see in the left-hand side of this graph that a number of hospitals don't really have a system for identifying whether patients did or didn't have pressure sores. There's no surveillance in place. We've challenged those hospitals. We've also challenged a number of hospitals where the rates of recorded new pressure sores after hip fracture are over 15%. We've also raised question over what's going on in hospitals on the left-hand side of this graph, where about 10% of patients don't get an operation at all. That's very much out of the norm for the UK picture, where we're seeing only about 2 or 3% of patients not having hip fracture surgery nowadays. And those hospitals have been identified, and it's been highlighted to the team there that this is something they should be questioning their practice over. The third aspect of care that patients are keen to achieve is to be back home again on treatment to prevent future fractures. In this respect, since 2023, there's been a dramatic improvement in the use of bone protection. There's been a marked escalation in the numbers of patients receiving zoledronate. Essentially, about half of patients now receive zoledronate before they go home from hospital. There's another 10% of patients on other forms of bone protection. Very little oral bisphosphonate now being used, but about 15% of patients are also being referred on for DEXA scans or bone density scans, bone clinic. And we would anticipate that this probably translates through until about 2/3 of patients will now be established on effective bone therapy after a hip fracture presentation. That shows a really dramatic improvement in performance across the country over the time since 2022. But we are still seeing hospitals down the left-hand side of this graph where essentially nothing is being done. Nothing is being done to prevent future fractures, despite the fact that we know that somebody coming in with one hip fracture has a 25% chance of coming in with a future fracture. So I'd recommend you have a look at the report, but of course, more important than the report is to be engaging with the website at www.nhfd.co.uk, which allows you to see what's going on in your country, your hospital, your unit in enormous detail and live open access data that allows you to see the impact of local improvement work as soon as you start. Thank you.